Problems that have arisen with Dennis's treatment are quite numerous and can amount to be life-threatening. We have identified his actual and potential problems, which you can see on the slide behind us. The diagnostic exams have shown that Dennis is to have a low creatinine clearance level, or CRCL, which is undesirable at his age for the ramipril he is taking in conjunction with the ibuprofen. This combination can be problematic as his renal system is impaired and can develop into chronic kidney disease. For Dennis's chest infection, he was prescribed Augmentin Duofort, which AMH contraindicates the use for patients who have severe reactions to penicillin. His potassium levels are slightly elevated. This is caused by the ramipril, but is also elevated as Dennis has admitted to eating 3 bananas per day, attributing to the hyperkalemia.
Because of Dennis's diagnosis of diabetes type 2, AMH states that
Problems that have arisen with Dennis's treatment are quite numerous and can amount to be life-threatening. We have identified his actual and potential problems, which you can see on the slide behind us. The diagnostic exams have shown that Dennis is to have a low creatinine clearance level, or CRCL, which is undesirable at his age for the ramipril he is taking in conjunction with the ibuprofen. This combination can be problematic as his renal system is impaired and can develop into chronic kidney disease. For Dennis's chest infection, he was prescribed Augmentin Duofort, which AMH contraindicates the use for patients who have severe reactions to penicillin. His potassium levels are slightly elevated. This is caused by the ramipril, but is also elevated as Dennis has admitted to eating 3 bananas per day, attributing to the hyperkalemia.
Because of Dennis's diagnosis of diabetes type 2, AMH states that diabetics should not be prescribed metformin if their creatinine clearance level falls below 30 milliliters a minute. This also applies for the ibuprofen that he takes. Additionally, due to factors such as his diabetes and age, Dennis is automatically regarded as high risk of developing cardiovascular disease. Aspirin has been prescribed as a prophylactic.
So what does this mean for me? Do we have a therapeutic plan?
Well, Dennis, we have assessed your problems and we've come up with a therapeutic plan. First, we are replacing your Augmentin Duofort with doxycycline, as Augmentin Duofort is a penicillin antibiotic which could cause you to have an anaphylactic reaction. According to the Therapeutic Goods Administration, doxycycline is the next best treatment for your respiratory infection. Doxycycline is 100 milligrams taken orally, twice on the first day and once every day after. We are also replacing your metformin with linagliptin, 5 milligrams daily, because your CRCL levels are below 30 milliliters per minute. And this is a contraindication of metformin. Linagliptin inhibits dipeptidyl peptidase 4 and is the only drug for type 2 diabetes management that doesn't cause weight gain, can be taken orally, and isn't contraindicated by your low CRCL levels, making it suitable for you.
Ibuprofen is contraindicated in people with CRCL levels less than 25 milliliters per minute, and as yours is 10 milliliters per minute, this can cause serious renal impairment, which is why we are taking you off it indefinitely. Your age also contributes to the risk of severe renal impairment. When combined with your ACE inhibitor, this drug causes negative interactions and decreases the effects of an antihypertensive. Taking you off this drug will allow the ACE inhibitor to work to its full potential of lowering your blood pressure to its target goal of 130 on 80 milligrams of mercury. We are also stopping your simvastatin due to your poor CRCL levels. Taking simvastatin with renal impairment increases your risk of suffering from myopathy and rhabdomyolysis. If your CRCL levels improves, we will reintroduce it at 40 milligrams per day and continue to monitor your levels closely to ensure it is not having major effects on your renal system.
Due to your CRCL levels being less than 10 milliliters per minute, we are temporarily taking you off ramipril and aspirin, as these drugs can increase your risk of renal impairment. If your CRCL levels improve, we will reintroduce ramipril at 1.25 milligrams per day and aspirin at 100 milligrams per day, which is the lowest dose. If these drugs are reintroduced, we will continue to monitor your CRCL levels to ensure that they are not declining. If they do not improve, we will have to completely stop the aspirin and potentially ramipril in order to prevent renal impairment. The reason for completely taking you off aspirin before Ramipril is because aspirin is only being used as a prophylactic, whereas the Ramipril is being used as an antihypertensive, which is more important in your case. So after looking at the medical conditions, we came to a conclusion following the therapeutic guidelines as well. So there's just a few lifestyle modifications which you can change today, Dennis, which will be better for your health overall. So these lifestyle changes are walking briskly for 30 minutes a day, 5 days a week, reducing your alcohol consumption as well as reducing the salt intake in your diet, trying to lose a little bit of weight, considering natural remedies such as vitamins or supplements, and also creating a healthy exercise and eating plan with realistic goals.
We understand that Dennis may not wish to take more medications, such as an antibiotic, so it is possible for him to seek complementary medicines and integrative therapies first. Ultimately, we suggest the use of an antibiotic, perhaps in conjunction with these therapies. However, we could see a physiotherapist to learn about breathing techniques, and even a naturopath to learn about further natural remedies. As Dennis has been recently diagnosed with type 2 diabetes, the TGA suggests that he should see a dietitian to help him make healthy diet choices to aid with the treatment of his diabetes. We also suggest that Dennis should seek professional help with exercise, perhaps by talking to his doctor about an exercise plan or seeing an exercise physiologist. Dennis will need to speak with both his GP and pharmacist about modifying his medications. He will need ongoing renal function tests to monitor his kidney function, either from his GP or at the hospital. We also suggest that Dennis seeks help for his mental health and feelings of loneliness. The first step being to talk with his GP, hopefully leading to seeing a counsellor or psychologist.